Hi all, I'm Kuldeep Singh. I'm recording this video to spread awareness on the option available for Ayurvedic treatment of anal fistula. I'll describe briefly about my own experience. Let me say about my case history. I was diagnosed with anal abscess and underwent a surgery in one of the prestigious hospital in the England. I got cuts on left and right leg. These cuts were around 6 centimeter and 8 centimeter. After a few months of the surgery, I noticed blood and pus discharge from the wounds. I was not aware about the kind of the problem that was developing. So through this pictorial view, I'm showing uh, typically what the abscess is looking like. This is the rectum and this is anus opening. Here I got these abscesses and I required these abscesses to be drained out by surgery. And my surgeon told me that this was nasty infection and it went deep and deep. So I was critically ill. And after getting this pus discharge again, after sort of 2 to 3 months of the treatment, I went to see a GP in the UK itself. I was kept on antibiotics and painkiller. This kept ongoing for a few months, and only little medical care was available because of the COVID scenario. I decided to move back to India, and straight away I went for a diagnosis. I underwent two MRI scan. My MRI report revealed that it was fistula. Before that, I was not even aware about this term. So when I underwent to this diagnosis test, I had severe pain and my condition was really pathetic. Wounds were bleeding. I was not in walkable condition and sitting was not possible at that time. So I was exploring for the best option available to treat the fistula, not only in India but also in the UK and US. I have gone through some reports by National Health Services of the United Kingdom and John Hopkinson Hospital of US. The reports were horrifying for me because in some of the technical document it was mentioned that if the length of fistula is greater than 3 centimeter, the chances of getting cured by surgery are only 15%. But if the length is less than 3 centimeter, then the chances of getting cured was somewhere around 45 to 50%. And these figures were really horrifying because I had this abscess problem, and then later on, after 3 4 months, it turned into fistula, and I had fistula problem from last 6 to 7 months, and I don't wish to get it back. So I was browsing a lot to get best treatment. I'm not from medical background and I was completely unaware about this treatment. So only through the browsing I came to know about the Ayurvedic treatment called Ksharsutra. In some of the document, it was claimed that this treatment is 100% effective and chances of reoccurrence are less than 10%. I was pretty much convinced by the method or by the treatment, but even then I had a lot of question in my mind about the qualification experience of the doctor. Being an Ayurvedic treatment, and in India there are so many self-claimed doctors. So I was in dilemma about the right qualification of the doctor, and thankfully I got the link of Dr. S.K. Singh from Google browsing. Dr. Singh is at present director of Sushruta Ano Rectal Institute, He has done his MS Ayurveda from one of the leading Indian institute, that is Banaras Hindu University. After that, he has been associated with many prestigious hospitals in Delhi itself. He got 30 plus years of experience to treat this kind of problem. I was very much convinced because of his experience and because of his profile, and I decided to consult it with Dr. S.K. Singh. As I mentioned earlier, I was not aware about this problem and its treatment, its cure. So Dr. Singh explained about the treatment here in this pictorial view. I have shown what kind of this problem is looking like. So in layman language, if I tell, here is the tunnel through which discharge is bypassed and eventually it turns into pus and blood. It leaks from the external opening from somewhere here. So what happens in this treatment? A medicated thread is inserted through the external opening from here, and it goes through this track, and it is extracted from the internal opening. This is called internal opening, and it is tied back somewhere here. Because of the continuous cutting action, the infected skin comes out, and in this treatment, the skin that is in between this infected track and the track of or the skin of this anus, it is peeled out, it comes out. The process is relatively slow, and what happens because of that? The cutting and healing action is almost simultaneous. So healing keeps on going simultaneously with the cutting action. Dr. Singh and Dr. Ravinder attended me weekly to change the thread, and I was told that it would be good if you keep on working, or you keep active yourself. It will help to get cured as soon as possible. Especially Dr. Ravinder keep on emphasizing to resume my normal activities, and I was involved in walking and jogging, so that helped me um, to reduce the track length, typically 1.5 centimeter per week. Within 2 months, I got cured from this problem. When the treatment was going on, in my case, I got almost 9 centimeter of this whole track length of the infected region, and this is how it decreases every week. Typically it was 1.5 centimeter healing, but in between there were some weeks when I was not physically active at that time. This particular treatment, its recovery rate was somewhere around 0 point 0.5 centimeter. It is advisable to keep physically active so that the cutting is promoted. Then how does this affect? Through this picture we can understand this is the track length of the fistula, and a medicated thread is inserted. Whenever the skin is cutting, it comes out in form of the pus or in the form of blood. Every week this thread is being changed, and what happens after few weeks, this back length keep on broadening, and on the upfront end or from this end, a new skin keeps on coming, which is the healthy skin. So because of the progressive action, or every week some length reduces, you can say after a few more weeks the back length is reduced to somewhere here, and finally only one scar is left on the skin. It is equally important after getting this thread out after all the treatment. It's equally important that you take care of your open scar, as it was recommended by Dr. Ravinder and Dr. S.K. Singh. I was given due attention and due care. This is the stage when the possibility of infection appears again if it is not treated carefully. So, in my case, I'm completely healed now. I'm able to walk and I'm sitting as I was doing earlier. I'm thankful to Dr. S.K. Singh for this treatment and Dr. Ravinder and the whole team of Sushruta Ano Rectal Institute. I would strongly recommend this kind of treatment to cure this abnormality. And as I mentioned earlier, this is much better than the normal surgery where you need to keep on bed rest for months and months, and even then, the chances of getting cured is less. Once again, I'm thankful to all team of the Susruta Ano Rectal Institute. I hope this will be very helpful for those who are struggling or those who are looking for a cure of this kind of the problem. Thank you very much.